Good day. Welcome back to Beyond the Stethoscope, where we discuss with medical professionals not about disease or hospital setting, but about their professional and personal life. And today we are together with yet another vibrant medical doctor. Doctor, please.
Hello viewers, I'm Dr. Sani Haruna. I work in Rashid Shakur Federal University Teaching Hospital, Lucy, and I feel honored to be part of this table, and I'm glad to be here with you in this gorgeous place.
We are so happy to be with you, doctor. Please let me start by asking this question. For example, let's say you wake up from sleep just now and you realize your whole life was a dream. You've been a medical doctor, was in a dream.
Yes.
Will you still go for MBBS or will you have everything?
Of course, yes, I will choose medicine over and over again. It is a passion I have developed for a long period of time, which there is no way I will change it. This is the best passion I have ever developed and it will not change. So I will choose medicine, I will choose to be a doctor over and over again.
Okay. Can you remember about receiving your admission letter for medicine? Was it a relief, a pure joy, or a panic?
It is actually a mixed feeling for me. I could remember when they released the admission list, I checked my name out of anxiety. I could not find my name, and it is there. It was there that time, so I could not find it. I checked like 3 times because of the anxiety.
You couldn't find your name?
Yes, I told my mom, what is happening? I didn't see my name in this admission list. She asked me to check again. I checked again. I could not find my name. So I was like, what is this? I started saying, so I did not get this admission, if this is the case. So she had to collect the list and check, and she noticed my name was there.
So because of anxiety and the mixed emotion, you couldn't see your name on the list of the admission. That was terrific. Yes. So do you think the curriculum of medicine in school has adequately prepared you for the real life medical practice?
Yes. When you look at the curriculum of medical school, especially in Nigeria, you will understand that it demands a lot of things. It demands you to be very hardworking, to be very consistent, and to be very committed. So, and apart from that, there is much discipline in medical school, especially in Nigeria. As you know that doctors should be well disciplined. So since from medical school, you realize that the training is not only about giving you knowledge, knowing things, knowing how to take discipline, so that you respect patient dignity, you take trust, you shoulder responsibilities very well, and other things. So for me, if the curriculum in this medical school is actually preparing us young doctors to face realities of life.
Beautiful.
Yeah.
What do you think is one of the hardest things in management of patient? Is it the history taken and the examination, or the interpretation of investigation, for example, ECG, echo, or counseling, or the prescription and all that, or follow-up?
Honestly, for me, one of the challenging issues we face is follow-up. You will start managing patients, you have gotten diagnosis, they have done investigation, and the patient is on treatment. And you will ask the patient to come back to the clinic so that you will see how far the patient is going. And you won't see the patient until when his condition got deteriorated. That is when you will see your patient coming with another things. So it's quite challenging, and For us, history taking examination is what we have been doing since medical school. So taking history, examination, investigation, all to get the diagnosis is not a challenging issue. And even to place your patient on treatment is not that challenging. That challenging is the patient also should contribute his part in his management. That is by coming back to the clinics and by taking you the advice you are giving to the
That is
patient.
beautiful. I understand. For example, in social setting outside hospital, what makes you remember hospital at instant? For example, a sound, a scent, or something, or a word you had. What makes you remember hospital at wherever you are?
At wherever I am, especially when I'm by the roadside or driving, when I see someone is driving fast, over speeding, I just remember, what if this patient, what if this man just get accident? So this thing will just bring patient, the hospital in me. Say, because I don't like to see people over speeding. You know, this road traffic accident is very common in this environment. So.
Okay, by the title doctor, do you think, how do you feel it? Is it more of pride or more of a burden for you?
It's not a pride, because there will be a time you don't want people to call you a doctor. It is a big, cumbersome responsibility to be called a doctor. In this our environment, you will enter accident and emergency, where maybe 20 patients or 30 are waiting for you as the only doctor there, and you enter, everybody wants you to see his patient. So if they even say or announce the doctor is here, you will just start feeling how burdened that name is. People will start coming to you. This is what happened to my patient. Please come and attend to me.
So, is there any specific quality that drawn you to specific people when you have a difficult case?
Yes, there are some qualities that when I notice someone has, so I actually ask him about this. When I find out that this one he reads, this one he asks questions about what he doesn't know, and you know, some people are, when the person is gentle. Well, I mean, the person is gentle in the sense that even by appearance, you will know that this man is a gentleman, very responsible, and I can trust him. So when I develop that trust in a person, actually, because I believe my patient trust me. So whoever I will ask who I have trusted.
That is right.
So when I found that you have these qualities, so I will trust you and I will ask you everything about what I don't know.
If there is one subject or course you are capable to add in medical curriculum, be it finance, ethics, guidance and counseling, communication, which subject or course will you add?
You know, in our medical school, I think medicine doesn't teach us how to take care of ourselves responsibly. How to take care of ourselves. They will teach you call for help, not for yourself, but for your patients. They will not teach you how to call for help for yourself. Even if you call for help, sometimes the help will not come until you collapse or you die. That is when the attention will be drawn. So for me, if I will add something to the curriculum, I will actually add this issue, how a doctor should take care of himself, how a doctor should deal with emotional problems and things like that, because a healthy doctor will make, he is the one that will treat patients.
He will be more productive. what you know, there is a lot of cases of exhaustion and burnout for
Yes.
doctors. Cases of doctors dying on call
Yes.
or collapsing. So, what will you suggest that will help reform burnout and exhaustion in medical professionalism?
So, if we are to talk about this, we can find out what are the causes of this burnout. Why doctors will have 72 hours call straight without interval? Is it manpower or the system is designed to be like that? So if in our setting or in our hospital setting we find out that our problem is manpower, so we go and deal with that. The facility should employ more doctors so that they fill the gaps that burn out. And sometimes it is not about the manpower, it is about the system. The system is designed, I feel, for doctors just to suffer.
I understand.
So if we find out that our facility is dealing with this issue,
Let's restructure the system. I understand.
let's structure the system. Yes, this is I think these are the ways we follow.
If you can change one thing about the healthcare system, what will you change, doctor?
I want our healthcare system to be as standard as healthcare system you find in United States, thereby improving a lot of things. Health education is a powerful tool, so through that, I think I can change healthcare system in Nigeria or in our setting.
I understand.
Yeah.
Okay, doctor, you know, worldwide, it is believed doctors have the worst handwriting.
Of course, some doctors, they have a terrible handwriting. Few have very clear, good handwriting. And for me, the cause of that, my handwriting was very good when I was in secondary school. I entered university. So during exams, you will be given 10 booklets to answer 10 questions, maybe in 1 hour. And those 10 booklets, each one may carry 10 pages. And you will not be satisfied if you write enough to the extent that you satisfy yourself that I have answered that question. So because of the time frame you'll be given to answer things or to do things, you start writing anyhow, in as far as it is readable at that time. Because if it is exam, it has to be readable. In as far as it is readable for examiners, you just write. So it will gradually become your habit to the extent that you just write, whether someone can read it or not, you just write, which is bad for me, and it plays a role in mismanaging patients. That's why you find a pharmacist fighting with the doctor because he didn't understand what the doctor writes. Is this that? So it will be bringing issues that will contribute to patient mismanagement. For me, it's bad actually.
I understand. Okay, and what one thing you usually wanted to convey to your patient, but you find it difficult in terms of their management?
A procedure or medication or investigation must be carried out for the better management of that patient, and this patient don't have money. So patient will be complaining, I don't even have money to eat. Someone will just be yes. And this patient have trusted you that just let you heal my patient, and today you bring investigation of 10,000, tomorrow 20,000, tomorrow you will say you want to repeat that investigation that the patient suffered to do for 10,000. You say you want to repeat it. Next tomorrow you want to repeat it. So sometimes I will feel the burden of saying, hi, I want to repeat this investigation while the patient is facing financial difficulty, complaining that I don't have what to eat. And you have done this investigation and now you are saying you want to repeat it. So I feel the burden. So sometimes I feel down to tell patient that this is what is going to happen.
I understand.
Yeah.
And you know, there is a great advancement in technology. For medical field,
Yes.
do you have hope or do you think is more of a danger coming ahead?
It will contribute immensely in the management of the patients. Talk about laparoscopic surgery. Everybody knows, if now I tell you I want to do abdominal surgery on you and I will cut you from there to here, midline, I will cut very wide. Then I tell you this one I will just make small incision. Patient will choose laparoscopy.
Definitely.
So it is part of the technology advancement that is contributing to the patient well-being. Talk about imaging modalities that we didn't have before. If technology will be available for a setting, like in emergency, I can say, let me do this MRI, sharp. MRI is by the side. CT scan just very close to me. This is all technology advancement. It will contribute to the management. So for me, technology advancement is actually a very, very crucial milestone that we will achieve in the future.
I understand.
Yes.
Okay, talking about this AI and consultation. Okay, what can you say about patient that consult AI and go ahead with prescription from AI, or patient that consult AI then come to your office?
I don't have problem with patients consulting AI because part of my work is to give knowledge to the patients. What is your condition? I will tell you. I went to school to learn and I learned things, and you just went there, Google or ask AI, then you can't. Part of my work is to enlighten patient, is to give knowledge to the patient, explain to the patient, well, this is your condition. So I don't have problem patient consulting AI, actually, for me.
Beautiful.
Yeah.
Okay, you know, medicine is more about knowledge, and there are studies published every day. How do you manage to practicing and also your personal life?
You know, part of the advancement, someone will feel social media is bad for people. It has its bad side, but for us, take for instance, if a research body has a handle on Twitter and you happen to follow that handle, whatever they do, you will just get alert and you go and deep and see their things. So social media and our research, because the doctors must be reading, must get acquaintance with latest information. So through social media
handles, journals, research,
and other books. So we get acquainted with information.
Okay. And what is one skill that medical school has not prepared you for, but practice has forced you to learn?
Things that I didn't learn from medical school. When I graduated, I thought I would be at ease because I'm now a graduate, that things will be well. So later, I found out that the responsibilities are now real. Everything is real because during medical school you can run away from responsibilities. But here, can you run away and leave patients?
No. So, doctor, what is one misconception you had before becoming a medical doctor?
Yes, there are some misconceptions actually. Before, I thought not everybody can do medicine. So when I entered, I realized that almost everybody can be a doctor. It depends on how you committed yourself. And I was seeing the doctors as some different human beings, because they would be saying, this one will just go and open patient's abdomen. This is amazing. This one a human being that you just go and open someone's abdomen and you close, and this patient will just be alive again. So I see, this is not normal.
I understand.
There was this misconception. Doctors are always arrogant, they are just feeling themselves and things like that. Almost all, I thought all healthcare workers are like that, even though some are, especially some part of the profession, not doctors. They tend to have some issues with patients and their relatives. But when I entered, I realized that maybe even if patient relatives say someone is arrogant, it depends on so many factors actually.
I understand.
Yeah, which I don't have to see.
Yes, I understand. Okay, what one piece of medical field that impacted your life the most?
There was my supervisor during my project, Prof. Sani Haruna.
A professor?
Yes. There was time he called me, he sat me down, he told me, whatever you will do, make sure you do it well. What brought this issue is about my project, that he asked me to do something and I was resisting. He had to call me and
which one is harder, examination or real life patient?
From the beginning, I was scared of exams. I don't like exams. So later, I want to be examined. Yes, serious. I want examinations. I want to face exams.
Yes, I understand.
I want to have interaction.
I understand.
Even if the examiner happens to be the one that will be insulting, I want to face the examiner and have some. Not that I'm.
No,
I know a lot.
I understand.
Yeah, it's because that I just want to have that feeling.
Yes, I understand. There is preference.
Yeah.
We are actually coming to the end of the session.
Okay.
What medical advice would you leave us with all the general population?
Well, I will divide it into maybe two.
Okay.
I will give advice to healthcare professionals, then my advice for general public. I will start with healthcare professionals, both doctors and nurses and other professionals in the system. Let's improve on our interactions with one another, because it is not good as a doctor holding grudges with a nurse fighting with a doctor fighting with people in the lab. This will make a great negative impact on the patient's care. If there is coordination and there is good relationship between healthcare workers, this will reflect on the management of the patients. So let's treat each and every one of us with respect, dignity. Just because I'm a new doctor and this is a 20-year-old nurse, that doesn't mean I should disrespect this nurse, and that doesn't make that nurse to be treating me with disrespect because he's a 20-year-old working for 20 years. I'm working for a few months. So if we can improve on this, it will actually reflect on the patient management. And for general public, I will tell, especially patient relatives, they should have more patience while interacting with with patient and health
Healthcare
professionals.
professionals.
Yes. So, and things like that, and they should take care of themselves. Whoever feels sick, let him consult appropriate body. Don't feel sick. You say, I just minor issue, or you just went go to the chemist. Maybe the person in the chemist is so unqualified that he will not find out what is wrong with you. He will mismanage you. Then later you find out in terminal stage, and that is when you will decide to go to the hospital in terminally ill stage. So whatever you feel, go to a hospital. Thank you very much.
Thank you.